from the Asian Community Development Council. This is Family in Focus, Mondays at 12 noon on PHLV Radio.
Hi, everyone. Welcome back to the show. This is Patranya Poonswan. Welcome back to Family in Focus, presented by the Asian Community Development Council. And it's live here every Monday at noon on PHLV Radio. So thank you for being here and joining us. We're talking about a topic that is, I think, on top of mind for a lot of people. Obviously, COVID-19 is still, we're in the middle of this pandemic still, despite the vaccinations. People are still getting hospitalized, and we're still hearing especially children now as they're going back to school. I was just seeing the news this morning how many cases of children that are being hospitalized. So this is still affecting people in many, many ways. And we have a guest here today joining us on the show to talk about the impact of being hospitalized with COVID-19 and not just the medical impact and physical impact, but also the financial impact on his life. And I just saw his story recently on the news here in Las Vegas, and I just had to contact him and get him on the show. Kenji Kita, thank you so much for being here in studio, PHLV studio with me today.
Oh, thank you very much, and it's an honor to be here.
Yeah, it's great to have you. And also we have today on the show, and we'll bring her on in a little bit, Eva Solano, who is the Director of Family Services for ACDC. And she's great because she really deals with the community directly with our organization when it comes to getting people registered for health insurance, which is so important. And Kenji, the reason we want to share your story, because you said, and this is what you told a local reporter here, how health insurance, if you did not have that, it would have been a much different story for you today after being hospitalized by COVID-19. So first, let's get right into your story here, Kenji. You were hospitalized. This was back last summer, right? And so tell me a little bit about that. How did you even, get sick in the first place?
Okay, so March, the company that I was working for kind of let people go because of the pandemic. We were shutting things down. So I was on unemployment, but I was doing little gigs here and there, what I could do from the home.
And you're videographer and
yeah,
photographer,
videographer
right?
and photographer. So all my shopping I did on Amazon or Target or Whole Foods and Sprouts. That's it. I self-distance all the time. I masked up, did what I could to protect myself. And on June 7th, I was, felt pretty bad and went to go get to urgent care. They tested me, and then 2 days later, they said, yeah, you're tested positive, stay home, but if you get really bad, go to the hospital. And by June 11th, I could barely breathe. I was confused, and that came down to the oxygen that wasn't going to my brain. That's why I was confused. Ended up in the hospital. They put me in right away, and I kind of crashed from that point on. From the 11th through the 20th, my health just got worse and worse and worse. And by the 20th, my doctor said, I have two choices. Either go on the ventilator or you're dying. And so I picked the first one. Let's go on the ventilator. But by then, I was thinking to myself, what am I going to do? Luckily, I paid my health insurance. Even though I was unemployed, I continued to pay my monthly premiums, and that's what it was there for. Thinking back, if I didn't have insurance, I would have signed the DNR or do not resuscitate, because they did ask, like, do you want to sign this? And I said, no.
So did that conversation of do you have health insurance, did that come into play?
No, that was different. They just asked, we're going to put you on the ventilator. Do you want us to do life-saving measures or resuscitate you? And at the time, I'm thinking, well, I have health insurance. They're going to pay. Yeah, it's going to be financially a struggle. But if I'm going to make it, I'm not going to sign it. But thinking back, if I didn't have insurance, knowing I was already in ICU, I didn't know how I was going to pay for this. So I would have signed the DNR.
Wow.
Now, knowing that I had 2 heart attacks while I was in a coma, I'm so glad I paid for the insurance and I didn't sign it. Because if I did, I would not be sitting here with you going over this, because they would have followed my wishes and let me pass.
Wow. So, I think what really kind of astounded me, and I'm sure a lot of people who saw your news story, was how much the bill was.
Yes.
It was not what you expected.
No.
You knew it was going to be a lot, but you didn't know it was going to
Yes.
be that much.
Yes, and I thought I was going to be on the hook for a lot more too. I had a $14,000 deductible, and the reason why that is a high deductible but low monthly payments. So I made that decision to do that. I didn't realize it was going to be in the just under $1 million.
It was like 900,000 something
916,000
for your total hospital bill.
Well, for the hospital bill.
Yeah.
There was also home care. There were nurses I had a nurse come every day from 10 a.m. to 7 p.m. Every day to give me my medicine, do my laundry,
Right.
feed me, help me with my physical therapy, occupational therapy. So I had to hire that person or a home care nurse for that. So there was a cost there. So grand total, I think I'm at about $950,000 out of pocket with the out of pocket expenses.
And
stuff
you
like
were
that.
in the hospital for how long?
I was in 7 weeks.
For 7 weeks,
7
and you had
weeks.
2 heart attacks
Two
during
heart
that
attacks.
time.
Yeah, 2 weeks in ICU.
Yeah.
6 weeks in a coma, so I couldn't do anything. And I had no visitors. I was on the COVID floor. So when they were putting me under I remember the nurse telling me, "I know you're scared," because I was crying and I was,
Yeah.
anxious. She goes, "All I want you to do is just lie back and let us do the work. You don't have to do anything else." She goes, "Just promise me you'll just hang in there."
Yeah.
And then I remember going out. Then when they woke me up, it was the same nurse, and she goes, "Hey, you made it. Good job." I was like, wow, like it felt like a couple hours.
Yeah.
But when she goes, "Do you know what day it is?" And thinking,
Wow.
"Oh, it's June 20th that they put me under. So what, like the 23rd?" She's like, "No, July 28th.
Yeah.
I was like, how did what happened?
Yeah.
Then they explained to me what happened, and there it was.
And you were saying that you were so thankful that you kept paying your health insurance.
Yes.
Because a lot of people sometimes, when they lose their jobs, they lose their health insurance. They don't want to put that extra money every
Exactly.
month, or they don't have
They don't
the
have
extra
it.
money.
And I completely understand that
Yeah.
because I went through the same thing. Through my 25 years of corporate IT career, I always made sure my benefits included health insurance,
Yeah.
whether it was health, vision, or dental. I made sure, when I accepted the job offer, that their plan was very good. And when I got let go, I was like, okay, so I have to get on an individual plan. I only did medical. I didn't do dental. Or no, I did dental. I didn't do vision. I should have done vision, but I didn't. That was
Yeah.
my fault.
Yeah.
But I've been told from a child, my father grilled it into me saying how important insurance is.
Right.
And it's a benefit that your company is going to pay for. Take advantage of it
Yeah.
because you never know what happens.
But you were paying for this insurance as an independent.
Individual
own your own
plan. It was
business.
own individual plan.
But you felt like, aside from all the expenses, I know, you felt this was a priority for
Yes, and the insurance companies will work with you on that. My premium before, when I was employed, it was around $360 for a married couple. Then when I got unemployed, my agent, my broker, I called her and said, "Is there anything that can be done?" She says, "Yes, there's rebates available. So you're on an unemployment insurance now, so let's apply for it and see what you get."
Yeah.
Well, they cut it down to $120.
So they work with you.
Yeah, they work with you. And then now, with the pandemic, with the CARE Act, I forgot what the acronym is.
Yeah, and I think
Yeah.
Vice can share a little bit more when
Yes.
she comes on. Yeah.
My monthly premium is actually $0 right now.
Wow.
Yeah. And so they've kicked in and said, you don't have to worry about it. Just continue on.
But I think this is the thing with insurance is that you never know when you'll need it. And
Right.
you need it in the most traumatic way, right?
Yeah. And because you don't deal with insurance all the time, it's not something you're an expert at.
Right.
That's why you should work with a broker.
Yeah.
They know the rules. They know the plans that are available.
Yeah.
And they will help you find an affordable plan. Yes. $360 when I was employed as a couple. If you multiply that out for the whole year, that's a lot of money.
Yeah.
And I told you I was on the high deductible plan to keep my monthly payments low.
Yeah.
So that means, you had to have that money available,
Right.
because that's a deductible payment that you have to pay every time you see your doctor until you reach $14,000. Again, most people think, how is that affordable? Well, when you're in an accident or you're in a situation like I was, that is where it really counts.
Well, I think, this is a good time, I think, to bring Eva Solano. Again, she's the ACDC's Director of Family Services. Vice, thanks for being here on the show with us today.
Having me. And first of all, thank you for sharing your story, Kevin. It's really very admirable of you to be able to share it and then survive. And also, it's really a story of hope that you are.
Thank you.
Yeah, and Vice, I know you work with ACDC, and one of the services that the organization does that is really helpful for the community is provide information and help in signing up for health insurance. So talk to us a little bit about that for people who don't know.
Yeah, so one of the programs that ACDC provides is the health insurance enrollment for our community. So we help them. We are one of the Silver State Health Insurance grantee, and through the Nevada Health Link, we are able to help individuals and their families shop, compare plans with the platform Nevada Health Link. And with that, we also have bilingual staff who are able to explain complicated health insurance terms and help them understand what the details of their coverage are.
And this is a service that I know you offer all year, even though we had the open enrollment just ended, but that doesn't mean that they can come to you and your team, the health navigators, year round to get information, right?
Yes, that is true. The open enrollment just ended last August 15. However, it is now the special enrollment period, wherein if you have a qualifying life event, we were still, for example, you just got married or you gave birth, then we were able to help you still find a plan for you. And open enrollment is going to be on November 1st, 2021 until December 15, if I remember it right, December 15 of 2021.
And I think it's really important to note here, Vice, that the service that ACDC provides to the community is completely free, right, for you to help them in multiple languages, oftentimes for the people in the community.
Yes. So our services are at no cost, and we have licensed health navigators to help you look at plans that will fit your budget and medical needs.
And you heard Kenji talked about just now the fact that, he was able to keep paying his insurance, throughout, and how important it was to him. Was this the information that you had to share with people in the community, how important it is that, when things like this happen, this is when your insurance kicks in? Because I'm sure you've talked to families who are struggling through, their economic status because they've lost their jobs. They're like, I don't know if I can pay for health insurance. I'm sure you have to relay these messages to them on a regular basis.
Yes, so that's what we are advocating for, not just being able to stay healthy at this time, but giving them, having a health coverage gives them peace of mind, because anything can happen. Even if you're healthy, accidents can happen. You may be able to, you really have to prepare yourself for potential issues that will arise, whether it is through accident or even health related issues.
Yeah, and let's, if you can expound on what Kenji brought up a few minutes ago, talking about how the premium for him has gone down. And I know the government has really stepped in to help people maybe pay less for their premiums if they qualify, right?
Yes, so with the American Rescue Plan of Act of 2021, it provided more savings and lower costs to individuals. So similar to what Kenji said, we had a client that was previously not as low as even $60 monthly premium, but with that American Rescue Plan, the premium was lowered to zero. So it allowed, really helped a lot of a lot of people with their health coverage, and even qualify them for more tax credits, and just being able to provide them with more savings.
Yeah, and that's great. And Kenji, let me bring you back in here. Just hearing that, this is the information that you've gotten from your broker, and you've gotten more information through this. And just kind of looking back now, I mean, I'm sure you have friends and families out there who maybe is still uninsured. I mean, you feel like your story is just resonating with them, and just say, this is what I've gone through, and this is the reason you're getting out there. And I know you have a Facebook kind of story that just kind of going through this whole journey, right?
Yeah, and it wasn't just the COVID for me. I'm type 2 diabetic, so I have to pay for my diabetic supplies, my insulin, my medication, and my glucose monitor. All that I have to pay for. So I knew if I didn't have insurance, that would kill me financially, because it's not cheap. And that's why I had to make that choice. Yes, it was difficult.
Yeah.
There were months I'm like, okay, well, do I pay the premium or am I eating dinner tonight? Well,
Right.
I'd rather pay the premium and skip one meal or two meals and have that so that I can buy my insulin.
It's so tough. And
It
just
is.
hearing your story and just seeing you in front of me, I mean, we hear this all the time, you know, as a reporter, you talk to, you know, different people and hear these stories on the news, but when it's someone that, you know, you're meeting personally and they're telling me their story, I mean, it really impacts, because this could happen to any one of us, right? This is not, you never know if you're going to get into an accident, if you're going to get COVID, you know, even if you're vaccinated, you can still be exposed, especially with the Delta variant around now. And, you know, if you're just tuning into this podcast now, we're talking to Kenji Kita. He's a small business owner, videographer, photographer here from the Las Vegas area, who recently shared your journey. You were hospitalized for COVID for weeks, and your final bill came in and it was close to $1 million, which was just astounding to me. But this is the reality, right? And not just you. There are people all over the country who are being hospitalized for COVID and just kind of shocked at how much the expenses were. And you were shocked. You didn't realize it was going to be that much.
Yeah, I didn't realize it was going to be that much.
Yeah.
It was a sticker shock.
And the insurance help brought it down to how much? What was the kind of the after that?
The emergency room visit was actually zero. I wasn't responsible for anything.
Wow.
Because by then I went through my $14,000 deductible, yearly deductible. So from that point on, the insurance plan kicks in and they paid for everything else. I'm sure my insurance company probably applied for government assistance to pay for the bills and stuff like that. But that's what they're there for, and they do that on their side.
Yeah.
So when I got that statement and I looked and it said $0 that I'm responsible for, I was like, wow, this is like the best, you know, decision I've ever made. And
Yeah.
yes, there were struggles, 100% struggles.
Right. But you got to think, if, you know, you didn't have insurance, where would you be right now?
I would be dead. Like I said, if I didn't have insurance and I knew I was going to be on a ventilator in ICU, I would have signed do not resuscitate. And then I had 2 heart attacks. That would have meant the first heart attack, they wouldn't have brought me back.
Wow.
And I wouldn't be here. And during my recovery, I mean, it was 2.5 months of being bedridden. I was a 47-year-old infant.
Yeah.
I lost all my muscle. I couldn't walk, so I had to relearn how to walk. So when you're lying there in bed trying to recover, the things that are going through your mind is, why am I still here?
Yeah.
And emotionally, I went through so many deep holes, and it got to the point where I'm like, there has to be some reason why I'm here.
Yeah.
There has to be. And when that article came out and Steve came and did the interview, it gave me one reason why I'm here.
Yeah.
This is why. And if I could help one person out, that's all that matters.
That's amazing. And I'm sure it hasn't been easy. You know, it was a path for you to get to this point, and I think you really kind of push that point that it's not just the physical and the medical, but all the financial and everything, all the impacts that come with COVID-19 and this pandemic. And it's not just you. There's so many people out there being affected by this, but you sharing your story maybe could help someone just think about putting their health first, whatever, they choose to do, getting health insurance, getting vaccinated, or going to a doctor on an annual basis and making sure you stay healthy, right? And this, I'm sure, is getting you to really think about that more than ever.
Yeah, it's sad that I had to go to this point, hit rock bottom, to appreciate life.
Yeah.
Like, if I didn't go through it, I don't think I would have the same mentality. But now life is short.
Yeah.
You can't let the small things bother you.
Yeah.
And I think empathy is missing right now across the whole world. And I think it helped my outlook in life.
Yeah.
With everything I went through. I'm mentally, emotionally, and physically better than I've ever been in my 48 years of my life now.
Well, it's just been amazing to hear his story, and Vice, I know you're listening, and I'm sure as impressed as me of what his journey has gone through. But with ACDC, I know you help with the health navigators. I know people have been asking some questions now about the health services that we offer aside from health insurance. I know we've offered COVID-19 vaccination clinics, for the last 5-6 months. It's been a while, but you're still offering that, but not on a regular Sundays, but you're still doing pop-ups, yeah?
Yes, so we've been offering the vaccine at our stationary clinic at Shanghai Plaza since April. And then even though that clinic ended already for last August 29, we will still do pop-up clinics at various events. And we'll still do pop-up clinics as well in our Shanghai Plaza location. So we provide the Pfizer vaccine at our clinics, but with Tour Health in our succeeding events, we will be offering all three vaccines to our community.
Yeah, and we're seeing some pictures from the clinic you just did, and you have a special event coming up, right, Vice? Coming up October 1st.
Yes, well, actually beginning this September 3rd, we will be at the First Friday Las Vegas in downtown, located in the Art Square. So we will be offering vaccination. All three vaccines will be available on that day, and in the coming weeks also we will be at we will do a vaccine at the we have the college readiness boot camp at UNLV. So we will be doing it at the student union. We'll also be participating in the Hawaiian festival coming up on September 11. We'll be providing vaccination as well to our community, and in the coming weeks we'll expect not just the COVID-19 vaccination, but also flu that we will be offering beginning on September 25.
Yeah.
So just tune into our website for our upcoming events on immunizations and vaccination.
That's a really good reminder. Flu shots, people do need that too now. So yeah, acdcnv.org for more information. Etta Vice and her team will be there to help. And just wrapping it up, Kenji, and you said right now you feel pretty good. You have some long-term still, it's kind of, what do you call it?
Long haul.
Yes. Right? So you're still feeling that a little bit.
Even after it's now 14 months from the day they discharged me.
Yeah.
I still have shortness of breath. It's not as bad. I just have to build up my lungs. The MRI shows it's called glass lungs, but there was damage from the ventilator. And then I have short-term memory loss. And again, that was probably because of the lack of oxygen to all my organs, and especially my brain. And that's what's causing short-term memory loss. But the doctors are like, you just need to hang in there, work on it, exercise as much as you can, push yourself, and you'll get back to it. Again, this is all new, so we don't know what the cure is. But these are the things that you can do to make it better. And those are the two things that I'm still suffering from.
Yeah, but you're a small business owner. You're still going strong here, and the financial impact. I'm sure that, it's something, I mean, when you're going through that and the way you're describing it to me, it was such a traumatic experience to your health. But if you have to put that financial on top of it, that's just, I mean, it's another thing.
And being a small business owner, I depend on the community.
Yeah.
And I know the community suffering as well. So it is very hard to even drum up business because I know they're already suffering.
Right.
They're trying to get jobs. They're trying to, photos for their portfolio, for their interview.
Yeah.
Which that means they don't have a job now,
Right.
but they start to pay for my services because I need to do the work, and it's been very hard. This community, though, this is why I love Las Vegas. Everyone knows each other. We're like 3 million people here, but we have a small town mentality. Everybody knows everybody here, and we all scratch each other's backs.
Yeah.
That's why when I moved here 19 years ago, it was the best decision I've ever made.
Oh, we're glad you're here, and we're glad you're doing well, and you went through that, and that you're sharing your story now, because I think it's so important. I think this is what an organization like ACDC has really been trying to push out there, how important it is to take care of each other, especially in the Asian American community where there are challenges, with languages and cultures and things like that. But I think having you to help kind of tell our story, put a face to a name. There's someone in the community who's gone through that, and how health insurance really came through for you. Any last word? I mean, you've really kind of given us a lot of hope in moving forward, but anything else you want to say? Just kind of what you went through when you want to tell the people.
No, like I said, health insurance is what saved my life in this point. Like, if I didn't have it, I would not be sitting here. So just think about it. I know, again, it's a struggle, but work with a broker or somebody. Give them your financial information, what you're going through, and their government programs that will help pay those monthly premiums.
Yeah,
so
good advice. Thank you so much, Kenji Kita, for being our special guest, a COVID-19 survivor, and he's giving out some great life lessons today. Eva Solano, Director of Family Services with ACDC, thank you so much for all the work you do for the community and for being here with us as well. And if you want more information on ACDC and all their services, you can go to acdcnv.org. So thank you to you both for being with me today, and thank you PHLV for having us here, and be sure to be watching our streaming on both PHLV and also ACDC on our streaming platforms. All right, well, thank you so much for joining us on this episode of Family in Focus, and we'll see you again next Monday. Have a great day.